Your mind drives everything you do. So when we think of wellness, we're talking about mental wellness, physical wellness, emotional wellness, and social wellness.
I'm a 6th-year breast cancer survivor.
They keep coming back into us with recurrent disease. They end up moving into stage 4. The best way is to blend a clinic that does primary care and breast cancer surveillance. If they have a recurrent, we can catch it early.
Why we should do weight management through Your Wellness Sources?
Because Your Wellness Sources does a comprehensive approach. It's not just about medication.
What else is new at Your Wellness Sources?
Dr. D, we got podiatry, guys.
George?
IV therapy. We have an immune booster. Come on down.
We want you to feel your best. And we know that women are aging fabulously, and therefore you should feel fabulously as well.
It's about you and me. Let's come together, positivity. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change.
Hey, it's your favorite girl, Dr. Dakota with Talks for Dr. D. And of course, the interim clinical director for Your Wellness Sources, as well as your director of podiatry and ancillary services. And I'm here with our medical director, none other than Dr. Marsha Lee George.
Hello, everyone. We are back again.
We're back. And what are we spilling the tea on today? What's new in Your Wellness Sources? Because we are fabulous. We are a boutique, I repeat, boutique practice offering the best in care. So what new things do we have for Your Wellness Sources? Let's list them.
So we stayed in line with all our integrated wellness care. And when we say integrated wellness care, we have to be comprehensive and make sure we meet the needs of our patients.
What does that look like? Because wellness is a hot thing. We know we talk about self-care is the new buzzword. Take care of yourself. Does that mean I'm going to the spa? Does that mean the gym? Am I doing, feng shui and sipping a tea? What does that mean?
Your mind drives everything you do. Mm-hmm. So when we think of wellness, we're talking about mental wellness, physical wellness, emotional wellness, and social wellness. So our approach to our patients is that we want to give you mental health support when you need it. We want to give you physical support. So we have our primary care providers giving you your annual physical exam, your screening exams, your pap smears, your well woman exam. And guess what? We have a breast cancer wellness survivorship clinic.
And as you know, for those who follow me on Talks with Dr. D, I am a 6th-year woohoo breast cancer survivor. So this is right up my alley to share with all my people. Tell us more.
Well, a lot of your viewers may know or may not know that I'm the author of Detecting and Living with Breast Cancer for Dummies. I've worked 16, 17 years at Johns Hopkins in breast cancer management, high-risk screening. I've published journal articles and did a lot of work on disparities in breast cancer treatment. So one of the things we noticed is that a lot of women after breast cancer, whether they had triple negative disease or they have aggressive disease, after 2 years of following the oncology team, they would discharge in the community to the primary care provider. But then later on, they keep coming back into us with recurrent disease. And the disease was more aggressive. They end up moving into stage 4, some of them even dying from breast cancer. So I said, the best way in order for us to reduce this gap in care is to blend a clinic that does primary care and breast cancer surveillance, knowing the history of someone with breast cancer, so they are able to aggressively survey them in the right way. So if they have a recurrent, we can catch it early. Absolutely. So this is where I developed the Breast Cancer Survivorship Wellness Clinic. It was first developed by me at Johns Hopkins. I used to run it at the Johns Hopkins Bayview Breast Center. And now I have it in the community. And this is a great way for if you have a diagnosis of breast cancer and was treated, I don't care how long it is, you can come here for your primary care in our Breast Cancer Wellness Center. And this is what it does. You have nutrition support, you have mental health support, you have your primary care providers. If you're dehydrated and you need IV therapy, you can get that. If you need a blood draw, you can get that. If you have hearing problems, you can have audiogram tests. If you have asthma, if you have breathing problems, you can get spirometry as well. So this is what we call comprehensive integrated. So we are excited. And guess what? Weight management. We got weight management.
Everybody's on the big old Ozempic, Mounjaro. I think it's fabulous. I don't think it's anything that anyone should be ashamed of. A lot of times there are people who are insulin resistant, which we see a lot in women who are menopausal, perimenopausal, and people of color, and leads to what? Diabetes. And many of our patients who are diabetic are because they had insulin resistance, such as myself. So Ozempic, Mounjaro, obviously Wegovy, obviously all the things that you hear, don't be afraid of, ask questions. And tell me why we should do weight management through your wellness sources.
Because your wellness sources does a comprehensive approach. It's not just about medication, because you take the medication. When you stop taking the medication, the weight
comes right back up. Big back.
In our program, it's a program of triad comprehensive services. You're going to meet with our functional nutritionist. Mm-hmm. You're going to meet with our psychiatrist team, our behavioral health counselor, so we could change that relationship you had with food, because there's a food to mood behavior.
When I'm stressed,
you eat.
It's not good.
Whether it's sugar, whether it's fried, know. So because we know when someone depressed, they might want to eat a tub of ice cream, or they might crave this and crave that. You have to have those comprehensive services to collaborate in order for that patient to come up. So when you stop this medication, the patient has already learned healthy behaviors in eating, and they already dealt with their emotional difficulties, such as the depression, the anxiety, and they learn coping mechanism so they could be successful and keep the weight off.
So one of the things that people want to know, and I know you're asking, is how much is this going to cost me?
Well, the good news is we know that this medication could be expensive, right? For like the GLP-1, GLP-2. We know that a lot of your insurance companies is going to pay for your care, right? If you have a chronic disease,
such as diabetes,
hypertension, you can see your primary care provider for weight management. But if you have a PPO plan that you could see another person outside of needing a referral, you can also see us as well. But if you are in an HMO plan, some of them require you to only see a primary care provider that's listed on your card. That's where you're going to have some difficulty. But if you're a PPO plan, if your provider refer you, you can come directly and you can see us for nutrition and weight management. But if you have an HMO...
I have a question. That's great. But what if there's many insurances that simply say if I'm not diabetic, hypertensive, they're not covering it? What is this going to cost me? Because we've seen all the commercials on TV about this price, and tell us what it costs and why is this a good deal?
Medications are very affordable, and we are very unique. We are really boutique because we understand that with gastric emptying drugs, sometimes it's difficult to tolerate with the nausea and different things.
Absolutely.
And we are able to customize how we bring this medication to you, really make sure that we can couple it with certain types of vitamins and certain things that would help you lose your weight robustly, but keep you healthy while you're losing the weight.
Somebody wants to feel horrible while trying to lose weight. You want to feel good. You want to show off that new body. You want to show off your new labs where your doctor's looking to say, what? My hemoglobin A1C, which tests for diabetes, is normal. What? My blood pressure's gone down. What? My cholesterol. What cholesterol? And that's some of the benefits of weight loss.
But one of the things I want to bring up, bariatric patients, come see us. A lot of you all have done bariatric surgery, did gastric sleeve. You lost 70 pounds, you lost 150 pounds, and you put back on 40 and 50 pounds. Come see us because we have a special program just for you for your weight management. We offer oral medications for weight management, injectables. We do IV infusion, weight management medications as well. So we have different things for you. And of course, your B12, you make sure that you supplement as well. So I see a lot of gastric bypass patients coming into us and being successful. And one of the things they say is that even after their surgery, they did not get the support with their nutritionist and mental health. So they can see why they went back into the unhealthy behaviors.
So we have weight loss. What else is new at your wellness sources, Dr. George?
Podiatry. Dr. D, we got podiatry, guys. We struggle so much with our feet. Some of us have flat feet. We end up having ingrown toenails. And then we go to these aesthetic spas out there to do our feet. And then some of us get toenail fungus. Some of us end up having to seek the care of a podiatrist. So one of the things we pride ourselves at YWS, Your Wellness Sources, is educating our patients. So when you come here, it's not just services you get. We take every opportunity to educate you. So when you come for podiatry, we're going to educate you how to care for your feet. We're going to tell you what type of shoes to wear. We're going to tell you how to prevent certain things. And it's very important because the worst thing is foot pain. Foot pain. You walk on your feet every day.
Let me tell you, so many of you, I could be at a restaurant and I'll have somebody be like, you know what, my foot hurts. And we'll take off a shoe. I have been from the bathroom to galas. I have been to the beach, especially Martha's Vineyard when we were there. People love to come and say, Dr. D, look at my foot, my ankle, my mama's foot. And what I want to do is make sure that we're walking strong, that we understand what our foot and ankle problems are, what's causing them. And some of the medical problems that we see, the diabetic foot, we see varicose veins causing a venous insufficiency, causing cramping, patients on certain statin drugs. We see patients that have sometimes cancers detected simply by the way your nails look. So, podiatry is comprehensive to make sure that you're at your best health and also fixing the things. We get our trauma. We get people who have dropped something on their foot, have twisted their ankle, broken their ankle, and podiatrists fix that as well. And then the bunion surgeries, 3D bunionectomies are one of the hottest things out there. Not 1D, 2D, 3D. And also, I've been published for my cosmetic incisions. Nobody wants a nasty scar on their foot, particularly people who are darker in complexion. We can get keloids. I will hide that for you. So those are things that are interesting that we're doing. And of course, this is summer season's coming. I know the Northeast, we're struggling a bit. And I know our friends in the South are laughing at us in Northwest and Midwest, but we're right behind them. And a lot of y'all like what? The ugly, ugly Crocs and flip-flops. I love them. However, you cannot live in them. A lot of patients will come in the summer and early fall with horrible arch and heel pain. So we want to talk about things like that and do a summer series. We are in summer, some of your nails, and it's kind of late now, but how can we get you better for the fall? Because you still be cute, or in the winter, and definitely for next summer. So podiatry is something that covers anything from the fungal nails, fungus on your skin, broken bones, skin problems, nerve problems, a lot of neuropathy caused by cancer, which I had at one point and went away, and even things for diabetes.
Wounds.
Oh, yeah. We did talk about the wounds and wounds for wound care. Some of the things to make these wounds that sometimes you've seen in your family members that are not closing. How does that get better? So your wellness sources takes care of that. So now that we have weight loss, we have podiatry. What else do we got, Dr. George?
IV therapy.
Now you're like, IV what? IV therapy. Some of you have seen these boutique, lovely places where people go for their IV hydration to feel stronger, whether it be simply to be more hydrated, B12 because your energy is low. There's so many things that we offer with IV hydration therapy. I'm going to let Dr. George talk a little bit about it. What do we offer, Dr. George?
We have an immune booster. So if it is that you know that you're just recovering from COVID or the flu and you need something to boost your immune system, you can have an IV nutrient therapy for that, right? We have energy. Sometimes we have our military guys who go for 1 month or 2 week training in the wild, pitching tents, and they come back and they're exhausted and they need a restorative.
Our moms with kids, I know y'all are tired. These kids, okay? That's you too. Grandparents, you too, but you can give them back.
We can give them back. We have a fountain of youth. For a postmenopausal woman who have dry skin, brittle hair, low libido, we have an infusion.
Ladies, nobody's saying not to do HRT if your doctor indicates it, but why not even feel better? There's so many things out there right now with menopause and perimenopause are hot topics. We want you to feel your best. And we know that women are aging fabulously, and therefore you should feel fabulously as well.
Yes. We also have IV iron. So if you're iron deficient,
now half of us are, and those who are menstruating, lots of women are iron deficient because of heavy periods, fibroids, and sometimes you just want to be in bed. Let's cure that. Let's make you feel better. That's not a substitute for seeing your OBGYN or taking iron supplements. However, this will make you feel fabulous.
Well, I would say come on down. We are located 4301 Garden City Drive in Hyattsville, and you can see us at www.yourwellnesssources.com. Come on down. We accept most or even all insurances. We covered Virginia. Yes, we do.
What about your weight loss? You said that you expanded. Where are your weight loss being covered?
Well, we covered New York, New Jersey, Delaware, Virginia, and Washington, D.C.
Now, you know that I am a tri-state girl, and I'm going to be sharing this video quite a bit. So come on, don't ask me how the what, you know what to do. You log on from the comfort of your home and get to meet with Dr. George one-on-one for that personal effect. Podiatry, you know, you have to come on down. Unfortunately, find me, my friends in Maryland, Virginia, and DC. And we keep growing and growing. We may be showing up in a new state near you. You know how to follow us online, subscribe, like us, and we look forward to next time.
Thank you all for coming and enjoying us. I just love our patients. I love the way how everybody spread the word, teach one, tell everybody about who we are and what we stand for. We are such a unique boutique practice. We care about our patients. Our patients is not just a number, they're a family.
Exactly. Look out for our monthly podcast. Look out for our IG clips, Facebook. We're everywhere you want to be. Walk strong.
Come on, work it out. What? Come on, work it out. Come on and work it out. See, health is wealth. Come on and work it out. You at the gym right now. Come on and work it out. See, health is wealth. Come on and work it out. Yeah. Come on. It's about you and me. Let's come together, positivity. It's about me. Health is wealth. Gotta take care of myself. Cause ain't nobody gonna make the change but me. So let me put in the work and be the best version of me.